We believe that federal government shares with other levels of government the responsibility to provide equality of opportunity for education and housing for all persons in the U.S., regardless of their race, color, gender, national origin, age, sexual orientation, or disability. And we took that position in 1969. We've expanded on it in 1972, 1980, and 2010. The League of Women Voters of the U.S. states that we support legislation to equalize the legal rights, obligations, and benefits available to same-gender couples with those available to heterosexual couples. And also, we believe that anti-LGBTQ discrimination is a form of sex discrimination. So that is why we have this meeting on this topic today. A quick note, I see, do you all see Debbie standing there? You want us to say good morning? Is that why you're standing there? Debbie is reminding us that she is videotaping today's program, and every sound we make will be part of the recording. So we're supposed to shush when we can't. Cheering's okay too. Right? So the topic of today's program is both timely and important, and we thank our co-vice presidents, Connie Taylor and Andrea View. These programs don't come together magically, and we always seek the best speakers, and today is no exception. And now I'd like to introduce Connie Taylor, co-vice president.
Good morning, everybody. Thank you again for coming out in the rain, really nasty weather all day. One of our panelists, Owen Wade, could not join us today. He is, he's really a policy expert. He has recorded some of his answers, and we will post that on our YouTube channel. He is a trauma support specialist for first responders with Mid-American Regional Council, and that's why he's not here. He's doing very important work for the community. And now I'm really pleased to introduce you to our moderator today, Amanda Glass. Wave, Amanda. Amanda is an associate professor of chemistry at Johnson County Community College. She's a member of the DEI committee leadership team there and is a co-advisor for the Gender and Sexuality Alliance on campus. This past year, Amanda led a team in the reintroduction of Safe Zone workshops back to JCCC. And Safe Zone is a national allyship training curriculum designed to educate and help create safer spaces for members of the LGBTQIA+ community. Amanda clearly is wearing an ally shirt, and it just proves that she is a fierce advocate for racial, social, and environmental justice. And by the way, she's also a member of the League of Women Voters of Johnson. So thank you for stepping in and being our moderator today. And now I'll turn everything over to you. Thank you.
Thank you so much, Connie, and thank you for the organization of this. I want to reemphasize, I know it takes a lot of work, all of you. Can everybody hear me okay? Hold it closer. Okay, okay. I will become intimately involved with this mic.
Like an ice cream.
Okay. But I won't. No, but no. I do want to point out, so our goal for today is to really facilitate a conversation about this. So we want to make sure people feel comfortable to ask questions. We're going to have a conversation up here, the three of us. But if there's a time that you want to interject a question, that's great. Also, we have these awesome attendee question forms. And I want to emphasize there's beautiful language on here that says, please write legibly. If you can't read it, you can't ask it. So that's wonderful language there. So if a question pops up and we're in the middle of a conversation up here, write it down. Even if we're not in the middle of a conversation, go ahead and write that down because we want to have rich conversation, and that's really going to happen with lots of good questions from y'all. But we do have lots of good questions to ask to sort of prompt the process. So I do want to add that our third panelist who's not here, in addition to him being this, we have the title trauma support specialist, he is the only one on the Kansas or Missouri side of the metro who is trained in this. He is the one. So this, I feel like, underscores, I'm sad he's not here, but his absence underscores the importance of this work and the fact that we need more people to step up and get trained in allyship and support people who are members of this community. So I will just add that to there. On my left, we have Heather and then Rubesch, and to her left, we have Karen. So I want to introduce them. Heather Rubesch is a longtime manager in computer software solutions. She is a community activist, having served as an advisor for QSpace. Heather has served on the board of Johnson County Parks and Recreation Commission and currently serves as chair. She led the movement to include gender identity and gender expression in policies on non-discrimination and diversity, equity, and inclusion. She is also the mother of an out transgender adult. Taryn Jones is a licensed social worker at Jewish Family Services as a volunteer manager. She is a community activist and serves on the board of directors for Equality Kansas and Midwest Rainbow Institute. Taryn was the first openly LGBTQ candidate to run for Overland Park City Council. Thank you both for your willingness to have this conversation. I want to tell you that we sort of have this set up with a policy discussion, thinking first, and then moving more into societal things. So we'll start with legal frameworks, thinking about policy. We're probably all familiar with the 2015 Rubesch v. Hodges. It was a landmark U.S. Supreme Court ruling that same-sex couples have the fundamental right to marry. What has been the impact for you personally and for the community? And I want to open it up to either of you to answer the question.
So in my introduction, I mentioned that I am a mother of a transgender young adult. I guess for me personally, it is the knowledge that my child can live an out, comfortable relationship, that they can travel comfortably in the community with their partner and not be worried about being discriminated against, to be able to, to openly express their affection for their partner.
For me, I think it made a huge impact. I am gay, and so it really opened up a lot of doors for me, and it makes me feel a lot safer knowing that I can be in my community and out. And I think that, I think the biggest thing is with the state legislature worrying about, or the Supreme Court even worrying about that they're going to overturn that. So that's a huge worry in my mind. But right now, I just feel so lucky to have such an amazing, supportive community.
So you spoke to this a little bit, but I think we want to take a step back and say, historically, federal and state laws have been discriminatory toward members of the LGBTQIA+ community. I want to add, does everybody know what LGBTQIA+ means? Does anybody not know what all those letters mean? Okay, I should have started with that. I'm going to talk through the letters and then I want to add a piece at the end. So L is lesbian, B, bisexual, G, gay, T, transgender, Q, queer, or questioning. Sometimes it could be used for either. I'm losing myself in the letters. I, intersex, A, asexual, and then it's really important that plus. Put the plus at the end to say that this encompasses a wide umbrella of identities, and we want it to be inclusive. So if somebody doesn't identify with those previous letters, then the plus is to allow that or to expand upon that.
You might explain intersex.
Okay. Anybody know what intersex means? I'm a teacher. I sort of can't help it. Sorry. They're like, you're supposed to talk to them. Like, why are you turning it out on us? So good question. So intersex, the historical term that is now considered derogatory, you may have heard the term hermaphrodite. It turns out that intersex is as common in humans as having red hair. It speaks to genetic, it speaks to the sort of genetic expression of sex. There's also a bunch of different terms that we in society have learned to be gender that are actually a bunch of different things. So gender expression, gender identity, and sexuality and romantic attraction are actually all different continuum that we in society have learned as one construct, but it's a whole bunch of things. So intersex is neither explicitly sex assigned as both female or male. So, and either of you is also free to expand on that. I'm not there.
Well, and I would just add that, like, when my child first came out, what they originally came out as and what they identify as now, as they sort of explored those things. So a lot of young people come out as questioning, and then actually move along the continuum and now identifies as trans. So I know I'm in a support group for moms, and a lot of moms get frustrated, confused, and it's completely normal. And most kids, I know we hear a lot in the news about kids coming out at a very young age, and it's actually much more common for kids to come out in puberty. And let's all go think for a minute, I know it's been a while for most of us, but just how crazy and confusing puberty was. And so you can understand why maybe what they initially felt or how they were attracted or what was going on with their body was just confusing. And so that's where the questioning really comes in. And then, if they're in a loving, supportive environment and they're allowed to explore that either with a therapist or even just by reading books, this is part of the reason why, books about LGBTQ experiences is so important to kids at that age, is that they need to sort of explore what along that continuum is so that they can sort of figure out where they identify. And so I know sometimes to people outside the community, it feels like a lot of alphabet soup, but it's really about figuring out who you are. And I think we can all identify with the fact that there's a lot going on for teenagers in society these days, particularly with social media and other influences. And so that's why I think we have to really provide a lot of grace for kids that when they initially identify as something, and it's not that they're confused, it's that they're figuring it out.
Right, because who knew who we were at 12? Like, I'm almost 40 and I'm still learning. The continuum is important.
Yes.
So we learn to check boxes. What is your sex? Female, male. That is the social construct. So a lot of this is understanding that there's a continuum. And I will say, I am a chemist. I am an ally and an advocate, and I've had to undergo a lot of personal unlearning and learning. So I want everybody to be proud of where they are on their journeys and to be willing to be vulnerable to ask questions. Because it's okay if you don't know the answer. I don't know all the answers, and I don't want to speak for anybody, but I don't think usually nobody, if we're willing to be messy and have conversations, to know all the answers. Yes?
So where does intersect, the actual word, how does that apply to how you described what it was?
Okay, so if you think about I teach chemistry and we talk about intermolecular and intramolecular. So if you think about international, that means between nations, right? So intersex literally means between sexes. So it is somebody who has maybe secondary sex characteristics that one might categorize traditionally as both female and male. So anatomically, there could be some combination of gonads. There could be different secondary sex characteristics. It's very complex. It's a good question.
But you said it was as common as having red hair.
It is.
Huh. I've never heard of that.
I think that's because traditionally parents were asked at infancy to make a decision and a child was just assigned a gender. So if a child presented with more than one sex characteristic, they would perform surgery in infancy. And the parents were asked, do you want this child to be a boy or a girl?
Yes.
That until like the 1980s, that was just routine.
And so then if you chose one of these, when a parent chose one or the other, then were medical or pharmaceutical things done to promote that choice?
So typically if
Can
you
you repeat
remove,
the question?
oh yeah, so if the choice was made by the parents at infancy, were pharmaceuticals and things. So to be very biologically is if you remove the penis and the testes, there's no need to give hormones because you've removed the generation of those hormones, and that child would have developed as a female, but that doesn't change the brain. So that child might actually have identified as male, but the parents made the decision before they really developed as a human to know.
Thank you, I get it.
Good question, and this was not, we're totally going up, so I'm sure Connie's like, what are they doing? Did I say something, I apologize.
No, I would much rather answer people's real questions than the ones we scripted. I think Karen feels the same way. We want to provide you guys the information that you feel like you need. So, and I was going to say this at the end, but I know because once upon a time I was in your seat where I went to panels to hear information because my child was out to me, but not out to the world. And so if there's anyone in this room that is in that situation where you have someone in your life who is out to you and you're doing research and you're not comfortable asking questions in this forum, you can get a hold of me through Connie, or I'll give everybody my email and phone number. There's nothing scarier than being the only person who knows your kids, who they are. You know, I mean, because one, you're scared because you want to do the homework and you want to educate yourself and you don't want your child to be vulnerable, but you also are afraid to ask questions, or I was afraid to join groups and ask questions because I didn't want to out my child before they were ready. So, and I'm sure parents the same. You know, if anybody wants to ask a question that you're not comfortable asking it in an open forum, we're here for you, you know, from this day forward.
Great. I was, no.
Sorry, I
No,
took
no,
again.
you did not, no, there's no track. The track is what this is about, bridging a gap and having conversations, right? So I just wanted to speak back to the different continua about gender expression and gender identity and sex assigned at birth, and just encourage you to realize that those are actually separate continua, and where one sits on one continuum is completely independent of where a person sits on another. The other is where somebody lies on these continua doesn't affect anybody else. It doesn't affect how they learn or how they grow or how they can love. And it's not really anybody else's business. So I joke that we get real personal real fast because we say, what did you have for breakfast? And then like the next question is, who do you sleep with? Not quite, but we do ask partner questions, for example, just in a like, I'm getting to know you in 30 seconds. And if somebody isn't out and doesn't feel safe disclosing that their partner is not the opposite sex or opposite gender, or they're trans or whatever, it can get uncomfortable really fast. So another piece of the unlearning for me has been to think about the way that I navigate new social situations, which is actually society's number 2. So I'm going to go back to policy. That was a real bad segment. We're ready to do this. So I want to ask the question again. So historically, federal and state laws have been discriminatory toward the LGBTQIA+ community. What do you perceive has been the biggest threats within the community and to the community?
So for me, with my work with Equality Kansas, I think the biggest threat, well, not only is, like I kind of mentioned, our Supreme Court, but also our state legislature. The last couple of years, our state legislature has tried to pass a trans sports bill. If I'm remembering correctly, we have 2 trans children who are in sports.
No, you're right. So 2, but only 1 is biologically male wanting to compete as a female. So we have 1 kid in the entire state of Kansas in a sport. So they're passing, the state legislature is having this entire law where only really because if you have someone who was assigned female at birth competing in a male sport, you would think they would actually be at a disadvantage biologically. So this whole thing is about one child.
So I think right now that's our biggest threat, at least in Kansas. We've been working hard to try and prevent that, but one of the problems is our state legislature. So we need to get out and vote, and we need to get out and vote for candidates who are going to support our LGBTQI plus community. Heather, do you have anything else to add to that?
No, I would say, probably, and maybe because I was an advisor for Q Space, the biggest concern that I have is actually with the school boards. Most of the kids, so I like to go to where most of the trans and LGBTQ teams that I know don't care about high school sports. I mean, like I said, I think there's literally for sure less than 5 in the state. Last I heard it was 2. And obviously based on, seasons and stuff, that could change. But when I was an advisor at Q Space, what we had was a ton of kids who were scared to death for their high school PE credits. I know a kid who did not graduate, had all the credits except was missing 1 credit at Gardner-Edgerton High School because that kid did not want to have to dress out in the incorrect dressing or locker room. That might be the only good thing that happened during the pandemic, is that kid was able to homeschool PE and was able to graduate, but would not have graduated, would have had to have taken a GED to graduate because they were missing a high school PE credit. So in my opinion, like I said, I like to go to where the actual people are being affected. As horrible as the Kansas State Legislature could be sometimes, most 16-year-olds don't care what they're doing. But they do care what their local school boards are doing and how it affects them every day in the classroom. My kids were in the Shawnee Mission School District, and I know some of the renovations this past summer at all the high schools included adding gender inclusive bathrooms. And that shows that the leadership of the Shawnee Mission School District gets it. They understand that there are kids in the world who, just aren't comfortable going into a male or female bathroom. And that's, like I said, I like to think of it at the most basic level. Leave a hand in the back.
Yeah, I have a question. I'm a member of an organization and we are looking at the possibility of creating all-inclusive bathrooms. And so I've been reading the Johnson County codes, and for churches, which is where we're looking, it still says in the Johnson County code that you have to have a certain number of stalls for males and a certain number of stalls for females based on the size of your organization. And so I just wondered if any of you know anything about that. Like, is there a way for us to circumvent that so that the restroom is all inclusive?
So I do know a lot about this because I serve on the Johnson County Parks Board. So what we've been doing is single entry bathrooms. Like, if anybody's been out to Mid-America or Mid-America West Sports Complex recently, we just did a $40 million renovation there, and we added family restrooms, which are single door entry, and those are essentially gender neutral bathrooms. So you can still have male bathrooms and female bathrooms, but you're allowed to have single door bathrooms that are gender neutral.
Okay, it doesn't really solve our problem because what we really wanted to do is make every restroom all inclusive, and so we're just trying to navigate that and figure that out, because sometimes if a youth or someone is always going to the family, the single unit family restroom, they're outed even if they are not ready to be outed.
I completely agree. And it's harder with older structures. That's why we've been able to do more with our new buildings or new facilities that we have renovated. But I don't know if anybody been to Meadowbrook Park. The outdoor restrooms there are all single entry. So there's like 3 doors and they're all just male, female. So that's part of how we've addressed the issue. And because, let's face it, I used the female bathroom. There's usually a huge line there and the men's doesn't. So by doing single entry bathrooms or you actually help with crowd control too.
Beautiful, thank you. We are at 9:30, so this is kind of our segue. I'm gonna change my mind. I want to go, your question was a great question. I wonder if you can get the number, because it's number of stalls. I don't know if there's any way that you can have that count for number of toilets if you were doing individual single entry. I also love the language here. So if you can walk away from with one thing today, realizing that the way that intentional language matters is huge. And so calling them gender inclusive bathrooms instead of family bathrooms, for example, I work with college students. Our gender neutral bathrooms are called family bathrooms on campus. I think, Andrea, can you confirm that?
We have family bathrooms.
They're called family, right?
But they just did a renovation on one of our buildings, and they actually petitioned the county and the city of Overland Park to do a gender neutral bathroom in that facility. So I think you can get like a waiver, but you have to go through.
So what Andrea said is that JCCC, the names of our bathrooms are family bathrooms, but awesome. I will follow, you're next. That we have family bathrooms, but what I was going to say is talking to college students who would use those toilets, those bathrooms, they don't want to go into a family bathroom because they're not a family. So for the same reason you were saying they might feel outed if there's multiple options. There's also a whole bunch of stuff that it's like what we do in the bathroom is private. So single holes are nice, right? Just going into one room where you're not with friends. But thinking about the language, calling it a gender inclusive bathroom or just a bathroom and not a family bathroom is awesome. Yes, please ask a question.
My question is, how can we get to the straight community that all-inclusive bathrooms are beneficial to them? Because what I'm thinking is, sometimes we're out to breakfast and I need to use the bathroom and it's occupied. And if you could go legitimately into any bathroom as a straight person, it's to your benefit.
No, I agree completely. I actually spent quite a bit of time in Europe this summer and they don't do male-female bathrooms. They also, in Europe, the door goes all the way to the floor, which I just think is nice. If we start, and I think that's part of the reason that their bathrooms are all inclusive is because they don't do this like partial petition, So, that may be what I don't know enough about the codes to know if that gets you to where you could label everything. But if everyone goes into their own room and closes their own door, then it's your own business, right?
And I think that just has to happen. I don't think there needs to be marketing on it, right? So I've gone to Hy-Vee or other public places where there's multiple bathrooms, and I think it's delightful. Like you just get to go. I think we should think about the labels we put outside of them. Often there's a picture of somebody wearing a skirt and somebody wearing pants. But in terms of how can we get the straight community to care about it, I think we just need to offer them and people to realize single holes are lovely. But maybe that's idealistic.
I told you I'm in an online group of LGBTQ moms. People post signs all the time. If we see things that are inclusive, it just sort of makes us feel good to see our kids being accepted. And one of the common signs that gets posted is outside of a bathroom, and it says, "I don't care where you go as long as you wash your hands." So maybe that's a good way to make it more accessible to straight people. Is we change the signage to say, "We don't care who uses this, but please, use good hygiene."
And I think there are some examples in the community that are already doing this. Like, I don't know if any of you have been to BRGR over in Corinth. Yeah. So their bathrooms are like that. They just have like 5 stalls, go to the floor, whoever wants to use it. And then they have one communal, like bunch of sinks outside. So I think, we start finding opportunities, like things like that in the community and being like, oh, well, they're doing a really good job of this. Like, how can we get other businesses to do that too?
That's great. And access to menstruation products. Universal access to trash cans and menstruation products. I would encourage you to change your language there. Andrea helped me with this. They're called menstruation projects. products, not necessarily feminine hygiene products. But we're gonna switch. We talk about toilets and bathrooms a lot. It's fun. It's important. Let's switch to thinking about Heather's work with the Parks and Rec Commission. So the Parks and Rec Commission included gender identity and gender expression in its DEI policy in October 2021. What was the impetus for making that policy change?
So honestly, there wasn't an impetus other than we have a D&I committee that is 18 staff people and 2 board members. So it wasn't that we had a huge number of people knocking on our door saying you need this. We just, part of our mission with parks is to try and be as inclusive as possible. And we're doing this in all facets. We actually did a huge ADA study and found that we had 4,000 defects across our facilities. That was about 4 years ago. And part of it is because many of our facilities were built in the 70s and 80s before ADA and to our credit, or to, part of it is ADA rules are constantly changing too. So there were things that were compliant 20 years ago that aren't compliant now. And so as part of doing our ADA study, we started looking at inclusion overall. We are also actually, hopefully this month, opening our 3rd fully inclusive playground. So for us, it is more than just, we were taking a look at inclusion and diversity and equity across all forms of diversity and equity. And as we were doing that work, I stuck my hand up and said, we don't say anything about gender expression and gender identity. Now, I told you a minute ago that my child was out to me for quite a while before they were out to the world. When I was doing this work on the Parks Board, my child was not out. So I was doing all of this advocacy, not sharing my personal story. And actually, in some ways, I think that might have been a little more powerful because nobody felt pressured like we have to support Heather in this because it's her kid. Because I actually feel like maybe that puts my fellow board members in a weird position. But I will also tell you it passed unanimously. So just because people, just like all of you, like members of my Parks Board who had no idea what gender expression and gender identity was, but when they became educated on it, they were completely on board. I actually, that's why my phone up here, sorry, I'm not being rude. I have our diversity inclusion statement and then our actual policy. I thought we're the only Johnson County agency who has done a comprehensive diversity inclusion statement. I will tell you, Jeff Myers, who sits on the Parks Board, is also a county commissioner who is working on their D&I statement. So I appreciate that Jeff will be able to take forward what we did. But if you'll give me 2 seconds, I'll read this to you. And I think it is a good framework if you are part of an organization that may want to include language. So with regards to diversity and inclusion, Johnson County Parks and Recreation District believes that all people deserve equitable access to parks, facilities, programs, and services. JCPRD acknowledges that historic, systemic, institutional, and physical barriers create disparate disparities that limit opportunities for participation and leading healthy, fulfilling lives. JCPRD strives to make this commitment to diversity, equity, and inclusion and justice evident in all aspects of its work and organization. By committing to these values and visions, JCPRD can become an organization that fully welcomes and celebrates all that live, work, and play here. So that's our diversity and inclusion statement. And the actual policy is the Johnson County Parks and Recreation District does not discriminate on the basis of race, color, national origin, gender, sexual expression, gender identity or expression, religion, age, or disability status in employment or in the provision of programs and services. That means that if somebody registers for our triathlon and they identify as male, we put them in the male category. If they want to play in a recreational sports league and they identify as a gender, we don't ask them any further questions. They get registered in what they choose. If they come to us as an employee and they want to work for us in any of our programs, we don't question who they sleep with or what their gender is. We just enroll them in health insurance and whatever services that any other employee. When we passed this at our board meeting, we had an LGBTQ staff person come and speak in our open comment section. And she said, she's probably around my age, I'll be 50 in December. And she said, this is the first employer I've ever had who had it as part of our new hire orientation. And she said, it gave me the big hug that I made the right choice and I was working for the right organization. And to have somebody my age for the very first time feel included at their employer, I think that says a lot.
I want to sit on that. Imagine being 50 years old and just finally feeling like your employer gave you safe space to be who you are.
Yes. To have a picture of your spouse on your desk at work. I mean, think about that. If you never felt comfortable talking about your home life, I remember in the probably mid-90s, I worked with a guy, and I just thought he was a single guy. You know, we worked together, our cubicles were crossing each other, and it was during the Bush Gore election stuff, remember all the hanging chads? And I was the only other person in the office who was just crestfallen when Gore lost. And so one day he said, hey, I'm running out to get some lunch. Do you want to go with me? And I said, sure. So I, jumped in the car with him. And he said, hey, I just wanted to tell you that your support for Gore meant a lot to me because I'm gay. And this is a guy I'd worked with for probably close to 2 years at that point. He was in a committed relationship and owned a house with another man. I had worked across the cube wall from this guy for 18 months, for a little more than 8 months. I had no idea.
This question is for Heather. Did you get much pushback from board members on your policy?
So we had absolutely zero pushback from JCPRD board members. We did have a member of the Board of County Commission come and speak openly against our policy at our meeting. Now, this is an interesting, I'm going to explain that. If those of you don't know, well, and I'm not going to name the person, but I will, you can read it about it. The Shawnee Mission posted a lovely story about it. You can Google my name and read the coverage. So this is an interesting dynamic. The Board of County Commissioners appoints the Parks Board. So Becky Fast is elected as the District 1 representative to the Board of County Commissioners, and she appointed me to the Parks Board. So every one of us is appointed by an elected person. So when a BOCC member comes to our board, they just come as a citizen. They're not a voting member, other than Jeff Myers, who is the liaison between the BOCC and us, and he votes. But the BOCC has no actual governance other than they appoint us. So I will tell you that that person who came and spoke against the ordinance, her appointee to the board did vote for it. Now, I don't know how much longer he'll be her appointee having done that, but just because we're appointed by the BOCC, we are not beholden to do that. If Becky would never be not in support of equity and inclusion, but just because Becky appointed me, she has no sway over how I vote. We are a by statute created independent board. So just, I like to make that distinction. Libraries and some of the other boards are not, but we are, by Kansas State statute, our own independent governing body.
And I think,
Oh, sorry, one more thing I was going to add. After that person, I'll try to be gender neutral. After that person came and spoke negatively at our board, we had over 200 comments. After it was covered by the Shawnee Mission Post and other local news outlets, we had over 200 statements of support that came into our board, including people who came to our next board meeting in support. But we had, through our contact us form on our JCPRD website, over 200 statements of community support. So at the end of the day, it was 200 to 3.
I think the impetus question is a good one, and it actually speaks to the spirit of DEI, which is different. The impetus is inclusion, right? So it's about having an evolving conversation where ideally we're not having to react to somebody behaving poorly, but instead we think, how can we get ahead of this and make sure people feel included before they get excluded, right? So I want to switch over to Taryn, and I want to ask, what role has Equality Kansas played in policy changes at the county commission level?
So like Heather said, the county commission is working on a DEI statement. Another thing we thought of. This isn't something that we've done. We haven't had a ton of involvement as Equality Kansas necessarily with the county commission. But I know one thing we've thought about in the past and are still considering is involving the county commission in decisions for a conversion therapy ban. So I don't know if you guys are familiar, but with our non-discrimination ordinance, we went city by city and passed them almost every city in Johnson County. And currently we have 3 conversion therapy bans in the state of Kansas. One is in Lawrence, one is in Roland Park, and we just passed one in Prairie Village last year. And so that's something that we've considered doing with the county commission so that we don't have to go through, 10 different cities. I don't know if any of you are familiar with like what happened with the non-discrimination ordinances, but it was a lot. Like we went to every city and it's sitting through every city council meeting, hearing all these vital things. So to be able to do that at the county level would be really amazing, and to be able to kind of bypass doing that in every single city.
We have a couple of questions that I think would be really well directed at each of you. So there's one for each person. I'm going to do that, and we're going to kind of shift over to thinking about society. So it's been very wonderful. Thank you for the questions and engagement. So Taryn, what was your, I'm thinking of words, was your being gay an issue in your campaign? And if so, how did you handle it?
I don't think so. I was actually really surprised. I really didn't have any issues with constituents or other people coming up and saying anything to me. I really felt like I was pretty well supported in the community, and I feel really lucky that kind of there's been this shift and people have really been a lot more accepting. And I feel so lucky that I really didn't have any of that hate or, misdirection at me. Like I was grateful that, pretty much everyone was supportive.
I'll add, I was a very, very early supporter of Therese and knocked a lot of doors for her in the primary, and it almost never came up. We all were trained on what our speech was relative to her being an out lesbian, and I realized this was a Democratic primary, but it just almost never came up at the door talking face to face with other voters.
So this is sort of could be to anybody, but I feel like it's a good question for you, Heather. What is the distinction between those who identify as trans and those who've had sexual abuse?
So trans is a continuum just like anything else. So my child was assigned male at birth, came out as trans, but does not desire to have surgery. She is taking hormones, which basically, so she had already gone through puberty. So there's a difference between, let's talk a little bit about puberty blockers. So that's a lot of, you'll hear in the news, doctors are giving children medication that is permanently altering them. All they are doing, has anybody ever known a kid who had early stage puberty? Like I know my kids had a friend whose sister at like age 7 started having signs of puberty. And doctors give that 7-year-old blockers, even though she's a girl and she wants to be a girl, you don't want her to become, there are medical implications. So what they did is put that kid on blockers until they got to 12 or 13, the normal puberty age, took them off, and the child went through puberty normally. So that is what is happening with some kids who are, through the support of their pediatrician and a pediatric endocrinologist and specialist at Children's Mercy, are receiving puberty blockers. These are kids who are starting to have gender dysphoria. There's, little girls or, people who identify or were born female who identify as male who are starting to have disease. And you can imagine, if you felt in your heart and in your brain that you were male and you started having your period and started developing, that could be a very uncomfortable thing. And so what blockers do is it stops the process while the kid gets the requisite therapy that they need to decide, is this what we want to do? No one operates on children under the age of 18. Doesn't happen. Doctors don't do it. Therapists don't approve it. My college roommate, who happens to be my kid's godmother, runs Crawford County Mental Health in Pittsburgh. And so when my kid first came out, one of my first questions was, am I allowed to talk to your Aunt Amy about this? Because I needed a professional, right? I asked for permission to talk to two people, my best friend and my college roommate, and I got permission. But that's very important. If someone comes out to you and they're not out publicly, it's good to find out who you're allowed to tell. And I explained that I needed these people in my support system, just like they needed to come out to their friends first. And so that was one of the first calls that I made, was to my friend who was the director of Crawford County Mental Health, and I said, you know, what are the things that I need to do? And so that's where puberty blockers come in. At any point that you stop taking puberty blockers, your hormone levels come back up and you go through puberty. So if a kid identifies at age 12 and then at age 20 decides, you know what, maybe that was a mistake, the studies tell us that's less than 5% of the kids. Less than 5% that start on puberty blockers ever decide to, they call it detransition. So most kids who come out okay.
We were both reaching for a mic.
Okay, and I thought you guys wanted to interject, so I stopped. All right, so did I get away from the question? Okay, so identify as trans different than sexual reassignment. So having sexual reassignment surgery is not a requirement of being trans. You could be trans and never take hormones of the other sex, never, it could be someone who is assigned male at birth who never chooses to wear a dress. Being trans is more of a state of mind than it is a physical action. And different people choose to transition differently than others. Some, like my young adult, is taking hormones, but has said fairly emphatically, I'm not interested in any kind of actual surgery to transition. So, and I think that's, it's one of the big misnomers. And to be honest, it was one of the most confusing parts for me. I'm like, if you're a girl, then we'll go buy dresses and lipstick. And they went, no, I don't want any of that, you know? And so that's where the continuum comes in. So, you know, I think that just like I'm a fairly girly girl, and my other child, my cis child, is an incredibly girly girl. But my trans child is no less a girl just because she doesn't want nails and hair and, you know, all of those things. All of us know women who aren't into any of that, right? So why would it be any different for a trans woman? Trans women don't have to be drag queens. And that's, you know, and I think and honestly, that's part of the education that has to happen.
And gender expression and gender identity are different. So again, and we want to put them in one box and have them be on one continuum, but they are not. So, oh, I had another thought, but I just got it. You had a thought.
I had a thought. So when Heather was talking about puberty blockers and all those things, I just want to say that, like, it's okay if you don't know everything. Like, I am LGBTQI, and I don't think I knew about puberty blockers until maybe like 6 months ago. Like, I didn't know that was a thing. So it's okay to ask questions. It's okay to not know everything. The other thing I wanted to point out was Heather was talking about detransitioning. Another thing about detransitioning is those people who detransition usually do not do so because they don't want to be that gender. They usually do it because their life is so uncomfortable in that gender. People in their lives have made that so uncomfortable that it's just impossible for them, and they decide to detransition. So I just wanted to kind of bring that up, that like family and friend support is so important with that.
Yeah, and I wanted to speak a bit to the trans piece as well. So remember that you don't have to just be male or female. So if you are transgender, you may be gender non-conforming, you may be gender queer, you may be non-binary. All of those things are not cisgender, so they're transgender. I don't add that to confuse you. I add it to speak to the complexity. And I want to go back to the piece that this is fundamentally who these people are. It's just, it's as fundamental to me. I rock my, some people pay for highlights. I have them naturally up here. Right, so it's fundamentally to an identity as the fact that I like to rock my gray streaks.
So one of the things, if you knew my child before transition, one of the things that I think people were the most sort of like, my gosh, I guess I didn't know, because that child was an Eagle Scout, and a very young and very successful Eagle Scout. But none of that love of hiking and outdoor stuff is gender specific, right? I was a Gold Award Girl Scout back when Girl Scouts hiked and did more outdoor adventure stuff, sadly, and that's another commentary. Girl Scouts has gotten away from a lot of the outdoor adventure stuff. But that was one of the things that, like, when we started telling people publicly, they were like, oh, I just would have never guessed. They were so, and they would identify some trait that they identified as masculine. And so that goes with the sort of gender expression, gender nonconforming. What having a trans child has done for me is I've stopped and thought, they also really loved floral prints. And there's a lot of male clothing these days, go to the store and look, that are florals. And, you know, think of like, not Hawaiian shirts, but that kind of, you know, when afterwards, because you have to unpack a lot of stuff. And I had a lot of guilt because I was like, why didn't I know? Because that's another thing. One of the most irritating things you can say to the mom of a trans or LGBTQ kid is, well, didn't you know already? Guess what? No, I didn't. And I don't think it's because I didn't know my kid, because I knew my kid really well. It's that we don't have a lot of gender rules in our family. My husband was a stay-at-home dad for 9 years. I was the sole income of our family for those 9 years because I have a master's degree in computer science, and my husband and I met because we were both mechanics in the Air Force. So we already had a lot of gender busting norms in our family. So it's not surprising to me that my kids felt comfortable to explore other things, because without knowing it, I was a really damn good role model.
I was glad that somebody made the comment that gender changing surgery was not performed in minors, because I've often wondered if there are implications to a parent saying to their child, talk to me again when you're 18. So there are not surgeries, but there are also a lot of things that parents can do before the age of 18 to support or not support their child. It was mentioned that I was a member, an advisor for Q-Space. Does everybody know what Q-Space is? So Q-Space is a space for youth 12 to 24. And we actually lost our meeting location during the pandemic, but we met inside a church. And it was an affirming, supportive church. And a lot of the kids who came there told their parents they were going to youth group. And it was because youth group was safe with some of those parents that the parents didn't actually go, they were coming to a LGBTQ affirming group. And so I sat with a lot of, and ironically, I was an advisor there before my kid came out. So that's a whole nother thing. I will sit with my child occasionally and go, I'm still a little bit upset that I was one of the last people you told, considering I was such an informed ally. But anyway, that's a whole nother, that's teenagers and moms. So everybody who's had a teenager nod and go, yeah, I get what you're saying, Heather. So I've sat with a lot of teens who want to have that conversation with their parents, or want to have it with an important adult in their life, and they're scared. They are scared about how, and I say that because my husband and I are both incredibly open and vocal advocates. Like I said, my LGBTQ kid and I had knocked doors for Charisse together. And even my child, who had parents who were as openly ally supporting, it was still a scary conversation for them. There is nothing comfortable or guaranteed about coming out.
think that's something that we have to, just continue to affirm. And did I say all the right things the first 24 hours? No. You know, I said are you sure? How long have you felt like, all the things that now I want to kick myself for saying, I wasn't as 100% accepted because when it's your kid, it's different. And I think that's okay. And I'm vulnerable in telling you that because I don't want you to think that if you say the wrong thing in the first 30 minutes or 24 hours, that you can't get back. It's shocking.
Something that Nuru taught me in the few minutes that we talked in planning stuff, that sounds like we didn't plan. We did plan. There's lots of planning. But in a conversation, I think it's something that really struck a nerve with me that I want to mention to everybody. In minoritized or marginalized populations, often the first institution that teaches people about how they interact with other institutions like Parks and Rec or schools or the police is the family unit. Imagine being a member of the queer community. If there's nobody in your family that you know is queer, the first institution that you could experience that could potentially reject you is the institution that we are taught is our core. We're taught that more important than us is our family. So in terms of thinking about how the queer population has to navigate institutions and people and advocate and why allyship is so damn important, realize that in the queer community, that family could be that first institution that could reject them. And I'm sitting next to somebody who I'm gonna hug if she's a hugger at the end of this. I made a new BFF, I'm super excited. But she just didn't, this is a mom who supported the crap out of her kid, and she just admitted that there were some mistakes along the way. This is not every queer, I say student, because not every queer child's experience. I hear stories about, oh, my kid thought they wanted to be a dinosaur. Your kid didn't cry because they didn't have horns. Your kid didn't understand why their tail wouldn't grow, right? So there's some bad publicity in terms of like, what are we letting our kids do these days? And letting them, people like the wonderful humans sitting next to me are letting their kids be themselves.
Well, and I will say, my child came out just before their 18th birthday to us. And so it's a different conversation. And I readily admit, I may not have handled it 100% correct, but I think I probably would have been worse if they had been 10 or 12 or 13 and not had the information that I have now. So I had a child who had a chance to be in some relationships. They do those things. And so I understand parents who are scared and confused when it's a young child, because it's like, how do you even know yet? But that's where therapy comes in. That's where your pediatric, I'm super lucky that the woman who literally lives in the house behind me is a pediatric endocrinologist. And so there's nothing like being like, hello, I get to talk to you. And so there's a lot of informing and research and things that go into this. Allyship is active. I liked your shirt that, being an ally is a verb. It's also about doing your homework. And, we always say it's not the job of marginalized communities to educate. But that's part of the reason I do conversations like this, because I agree it's not my kids' responsibility, but I do kind of feel like now that I've sort of got a Dr. Google degree in being a transgender parent, that if I can spare anybody else or help anybody else along this path, it's part of atoning for what I did wrong in the beginning.
Get a new opportunity every day to be a better human. Get that on a box. That's how I sort of live my life. So we've got some good questions thinking about navigating societal issues and also in thinking about policy. So and I want to take a step back. So we talked about, oh my goodness, the 2015 case legalizes same-sex marriage. So one thing we haven't talked about in terms of the continua is commitment style. So poly families are still excluded. I happen to have a dear friend who we've talked about things and navigating, filling out paperwork at school. There's still 2 guardians or 2 adults in charge. And then there's other people you can put on the list, but there's no space for if there's more than 2. Right? So even in spaces where things feel kind of safe, and I know they don't feel that safe, there's still room for growth. So I just want to, food for thought. I like food. I like food. Okay, so are there insurance inequities that need to be addressed? For example, car insurance is more expensive for male drivers, and health insurance is more expensive for women.
Honestly, I mean, I think that's a great thing to bring up. At the day-to-day, I'm just thrilled that my kids' stuff is being covered by health insurance. And maybe that's a very privileged statement because I have a job and I work for a software company that is willing to pay for transgender therapies as part of our group health insurance. So the last thing I've worried about is whether or not that child's health insurance is going to be more because they're female rather than male. Because there's quite honestly so many group health policies that don't even cover basic care for transgender people. So I would love to get to a universe where that is the biggest problem that we have. I'd like to push for universal coverage of hormone therapy, universal coverage for puberty blockers, and those types of things. So yes, actually, this is another part of the, our trans, what is the continuum of trans? It's actually fairly difficult in most states to have your gender marker changed. So a lot of folks go with a name change and don't even bother to change their gender marker on their driver's license, things like that, just because there are so many process barriers to doing so. And you actually have to go to court and hire attorneys in a lot of states to do that work. So I don't know that my child will ever, even if they're living fully female, go to the hassle of having birth certificate, driver's license, passport, those types of things updated. And that's just, it's just a hassle factor. And we're just putting one more, roadblock in the way of folks wanting to live their lives.
I will put a plug in again. This is why inclusion and diversity policies are important. So that maybe next generation, these can be questions. I also want to publicly say JCCC added to their, I think it must be Blue Cross Blue Shield of Kansas City. I don't really understand. It's more Blue Cross Blue Shield, but gender reassignment this year is a covered thing for I work at JCCC for our employees, which I was really excited to see. So did you want to add anything there?
Really just kind of touch on what Heather said too, is like, I think that's the biggest inequality with healthcare is coverage of the assignment surgery, blockers, hormones. It all differs so much between insurance companies. And I think what Heather said about universally covering that is really something that's important.
Yeah, I just wanted to say there also are some states where you cannot change your gender marker unless you have had reassignment surgery, which is terrible.
So there was a comment that there are states that you cannot change your gender marker unless you've had you've gone under the knife and had gender reassignment surgery.
Yeah, and this goes to that confusion about what is trans. And like I said, you can be trans and never actually pursue any transitioning steps. Trans is a state of mind. It's it's how they feel inside their body, not an outward expression. That's the difference between gender identity and gender expression.
And it is not a mental health diagnosis, though. So I get nervous. I know 100% what you mean, but I just want to clarify. There was a time where it was in your head meant it was a, I don't remember is it DSM?
DSM.
It was a disease. It is not a mental health crisis. It is an identity of who you are and your core, like, again, like my example was big, terrible.
So I will say there is, so I'm going to make a little distinction. Gender dysphoria, which is sometimes the initial feeling that that person is getting that I'm in the wrong body, that is frequently treated by mental health professionals. Doesn't mean it's a defect. You know, it is just, that is what is coded as, that's part of the questioning process, is I'm starting to have gender dysphoria. That may be what sends you to, like if you needed to call so if somebody comes to you and they say, I just don't feel right in my body, I think you could call a mental health professional and say, I have someone in my life that I believe has gender dysphoria, do you treat that? Because there are therapists who will tell you they do, and there are therapists who tell you that they don't.
And of course, that's the unlearning the societal piece, right? It's because they're different from what our societal norms.
This has been so informative. One of the things I've been concerned about is the bullying of LGBTQ plus IA children and students by school boards, other local boards. That really concerns me.
It concerns me too. I'm somewhat lucky that my kids are out of the K through 12 school district situation. But what I see on the news just terrifies me. It really does. And like I said, from my time as an advisor at Q-Space, I saw how that manifested in kids with a lot more anxiety and depression. That's why it's really important. They say Trevor Project. If you're social media people, highly recommend you follow the Trevor Project. The Trevor Project is one of the leading LGBTQ advocacy groups for youth. They run not only a 24-hour hotline that kids can call, but a 24-hour text line. Because if you know kids, they don't often pick up the phone and call anymore, but a suicidal teen will text the Trevor Project. So keep that information handy if you ever need it. The Trevor Project says if there's one supportive adult in a kid's life, that lowers the risk of suicide by 1/3. So although school boards make a lot of press, I think it's more important that we have supportive teachers in the classroom. I think my child will tell you, because they started questioning when they were still at Shawnee Mission East, that having teachers who they knew were inclusive and supportive made a huge difference. So even though they weren't out, they knew who their safe people were. I think sometimes just having one really great community, for my kid, it was the marching band, can make all the difference in the world.
Amanda, Heather, Karen, what are your final thoughts to leave our audience with today?
So I think final thoughts, just keeping in mind, like Heather said, the state legislators, the school boards, think about, who you're electing to those and who your allies are. One thing we're fighting now is in Gardner Edgerton, they're trying to get a policy passed, and they've been kicking the ball for a few months on this, to get a policy passed where you have to use the restroom of your choice. Kids have to use the gender that they were born with, and all this stuff like that. Those are so important. So just kind of keeping an eye on your community, and also just being that supportive adult. I was so lucky, like Heather was talking about how sometimes you're, in your community, or I guess it wasn't Heather. Yeah. So talking about how Honora had how in Black families and POC families, your family is kind of your first kind of source for that. And I was lucky. My parents are really amazing. But not everyone is. And so trying to be that supportive adult for someone that's come out to you is so important. And having that person, having a community is so important. I have a lot of friends, but my LGBTQ friends, it's just different because they understand something that my straight cisgender friends will never understand. And so making sure your child has, you know, if you are a parent, if your child having some kind of community for them and being around people who are like them.
So I'm going to give you something that's a little bit hopeful. So when my kid first came out, they were actually leaving for college fairly soon. And so we moved them into the dorm. They got to live in gender neutral housing. They got to really sort of like start being trans in a completely new space. But I knew when they came home for Christmas break, we were going to have to, you know, make some announcements, sort of, you know. I live in a little neighborhood in Prairie Village where everybody knows everybody. And everyone in the neighborhood are my kids since they were kindergarten and first grade. And so I walk my dogs. So as I was walking my dogs, I was literally stopping at every neighbor who was out doing their yard work and sharing the new name and the new pronouns and doing this. And I have on my block young couples with new babies, all the way to, you know, people who have been in their homes in Prairie Village for 50 years. And not one person said, you know, oh, well, that's, you know, or walked back in their house. And when that child came home for Christmas and walked the dogs with me, everyone came running out of their house to say, hi, Sam, how are you? We're so happy to have you back from school. How's it going? And so, you know, and I will tell you, so the theme of this session was bridging the gap. And Connie asked me when we were preparing, how did you bridge the gap? And I said, I had a million uncomfortable conversations. But you know what? Not one of those conversations, not one of those people stopped loving our family and stopped loving my kid. So I truly believe, and I think Karen would say this too, that knowing someone who is LGBT, knowing someone who's trans, I mean, we cannot even put a tiny price on what TV shows like Will and Grace and The Ellen Show and things like that all have done for this community. And so now we've made a whole room full of people who have a better understanding. So I'm asking you, next time you're out in the world and you see, I know there's near my house, there's a CVS and there's a trans employee there. And I never want to like make them uncomfortable, but I always tell them how great their nails look or how fabulous their lipstick are. Sometimes just a compliment to the right person in the right situation can make all the difference in the world. And you're signaling that you're an inclusive, safe person. So please, please, please do those little things.
So I want to say two things. One, allyship and learning and unlearning and finding your own homophobia, because we all have it, is suicide prevention. I also want to say I got super nervous that I wouldn't remember what to say, so I wore it on my shirt. Ally is a verb.
Well, we did have a script handout, and we threw it out the window. But in our planning discussions, the conversation was really, let's just have a conversation. And I think
You wouldn't ask questions, so we wrote a bunch, but we loved it, you did.
so. Thank you to our audience here for asking the questions to keep the conversation going, to bridge that gap on social equity. So thank you. Thank you, Amanda. Thank you, Heather, and thank you, Taryn, and everyone. Thank you. We have a video. We'll check it out and upload it. But thank you all again. I appreciate it. Shannon?
A couple of follow-up notes, if I may. One is, as an organization, we are nonpartisan and we don't support or endorse any candidate. Doesn't mean that our panelists don't, and we encourage them to share their experience. That disclaimer on our part. The other part, a phrase that I wrote down, intentional language matters. If we all just give that some thought and see how we can apply it, maybe we will change a life, right?